Welcome to Medicalink. Don't forget to subscribe for more videos. Let's learn.
Hello friends, we are now going to talk about glomerulonephritis. The classification of glomerular injury, pathogenesis of glomerular injury. We'll talk about electron microscopy and immunofloroscence microscopy. So what is glomerulonephritis? Glomerulonephritis is also known as Bright's disease, and it is a disease that primarily involves the renal glomeruli, that is the inflammation of the glomerulus. So simply speaking, glomerulonephritis is the inflammation of the glomerulus. It can be focal, diffuse, segmental and global. In focal glomerulonephritis, only some glomeruli are affected, whereas others are normal. In diffuse glomerulonephritis, all the glomeruli are affected. In case of segmental glomerulonephritis, only a part of glomeruli is affected. If this is a glomeruli, only a segment, only a part of glomeruli is affected, and the other side will be normal. Whereas in global, the entire glomeruli will be affected. Now coming to the classification of glomerular injury, it is broadly divided into primary, secondary and hereditary. We'll talk about the important ones. In primary glomerulonephritis, it consists of acute proliferative glomerulonephritis, or also known as post-streptococcal glomerulonephritis, rapid proliferative glomerulonephritis, minimal change disease, membranous glomerulonephritis, membranoproliferative glomerulonephritis, focal segmental glomerulonephritis, focal segmental glomerulosclerosis, IgA nephropathy and chronic glomerulonephritis. Now secondary glomerular nephritis is mainly due to systemic diseases like lupus glomerulonephritis, which is caused due to SLE, diabetic nephropathy and amyloidosis. And in hereditary, Alport syndrome, Fabry's disease, Neil-Patella syndrome and thin membrane disease are the hereditary factors associated with glomerular injury. Now coming to the pathogenesis of glomerular injury, glomerulonephritis is the inflammation of glomerulus. So the inflammation can be due to antibody mediated, cell mediated or complement mediated pathway or alternative pathway. In antibody mediated glomerulonephritis, here the injury is caused by antibody, where antibody binds to antigen and it will form a complex, and this complex will result in glomerulonephritis. In cell mediated, injury is caused by T lymphocytes, and in alternative pathway, injury is due to complements. Now coming to antibody mediated injury to glomerulonephritis, antibody combines with an antigen to form an antigen-antibody complex. Whether antibody-antigen complex formation is occurring in the circulation, if antigen-antibody complex is forming inside the kidney, then it is in situ. And inside the kidney, whether the antibody is forming against a fixed antigen or whether antibody is forming against a planted antigen. So as we said, antibody mediated glomerulonephritis can be either due to antigen antibody complex being formed in situ inside the kidney, which can be either antibody against planted antigen or it can be antibody against a fixed antigen, or whether the antibody is forming in circulation. Now we'll talk about what happens when there is antibody against planted antigen. Let's say if a person is suffering from acute tonsillitis, acute bacterial tonsillitis or acute bacterial pharyngitis, then what happens? Some bacteria may enter into the bloodstream. Some bacteria will enter the bloodstream and it is carried to the kidneys. This bacteria will be carried to the kidney and will enter into the filtration barrier by afferent arterioles. Bacteria will come to the filtration barrier through the circulation and will get trapped into the podocytes. These bacteria will get trapped into the podocytes and will get deposited in the podocyte. So here bacteria, these red ones, these bacteria will act as an antigen. So bacteria is an antigen which gets deposited in podocytes. Thus it is known as planted antigen, because it is coming from somewhere and it is getting planted on the podocytes. So body will recognize this antigen and will form antibody. So the body will form antibody against these planted antigens. Now antibody will come through the circulation into the kidney in the filtration barrier. Now it will form antigen antibody complex. So antigen antibody complex is formed within the kidney. Therefore antigen antibody complex are formed in the kidney in situ and not from the circulation. So this will disturb the filtration barrier and will result in glomerulonephritis. So once again, here this diagram is representing a filtration barrier where the outer layer is the podocytes or the visceral epithelial cell. This blue one is the basement membrane. It is the glomerular basement membrane, and the inner red ones are the endothelial cells. These three layers forms the filtration barrier. Okay, so if a person is suffering from acute bacterial tonsillitis, then some bacteria may enter into the bloodstream and is carried to the kidney. Bacteria is antigen which gets deposited in the podocytes. Thus it is known as planted antigen. So body will identify the bacteria and will form antibody, and this antibody will go to the kidney in filtration barrier and form antigen antibody complex. Therefore antigen antibody complex are formed in the kidney in situ. So barrier will be disturbed and glomerulonephritis will occur. Now coming to antibody against fixed antigen. In the previous case, bacteria was acting as an antigen, but in this case basement membrane is made up of type 4 collagen. So here type 4 collagen of the basement membrane is acting as an antigen, so it is fixed. Now the human body is forming antibody against antigen which is self antigen. Here antibody are formed but not against planted antigen as we had seen earlier, but it is forming against a fixed antigen, that is the type 4 collagen of the basement membrane. So antibody will form antigen antibody complex in the basement membrane. So now this antibody antigen complex will destroy the basement membrane and will result in glomerulonephritis in situ. Now coming to antibody antigen complex formed in circulation. Bacteria is present in the blood and body is forming antibody against bacteria which is an antigen in the blood. Okay, so antigen antibody complex is formed in the blood. Now this complex is getting deposited into the kidney, so the basement membrane will be disturbed and will result in glomerulonephritis. So in this case, in case of planted antigen, bacteria was acting as an antigen which got planted in the podocytes, and antigen antibody complex are formed in the podocytes, thus resulting in glomerulonephritis. Now in case of antibody against fixed antigen, antibodies are formed against alpha 3 chain of type 4 collagen of the basement membrane, and the antigen antibody complex are formed in the basement membrane and thus destroying the basement membrane, resulting in glomerulonephritis. And In this case, antigens are the bacteria which are present in the blood, and the body is producing antibodies against antigens which are already present in the blood. Now this will form antigen antibody complex, and it moves to the kidney, and it will get deposited into the kidney, and thus resulting in the basement membrane destruction, resulting in glomerulonephritis. For the diagnosis of glomerulonephritis, there are three types of microscope used. So the three types of microscope used in seeing the glomerulonephritis are light microscope, electron microscope, and immunofluorescence microscope. So the light microscope is used to look at the glomerulus morphology, whereas electron microscope is used to find the location of deposit. It is used to find the location of deposit inside the glomerulus. So electron microscope is used to find the location of the deposit inside the glomerulus or the filtration barrier, whereas immunofluorescence is used to look for composition of the deposit in the glomerulus. So light microscope is used to see the glomerulus morphology. Light microscope is used to look for glomerulus morphology. Electron microscope is used to find the location of deposit inside the glomerulus or filtration barrier, whereas immunofluorescence is used to look for composition of deposit in the glomerulus. Now coming to electron microscopy of the kidney. In electron microscope, the deposits are seen as dark, homogeneous, and gray color. So if this is a glomerulus, where the outer one is the parietal cells, these are the podocytes, the middle one is the basement membrane, and the inner one is the capillaries, and these are the endothelial cells of the capillaries, and in between the capillaries we have mesangial cells, which are supporting cells. So we had seen that the outer one, these are the parietal cells. The outer covering of the Bowman's capsules are the parietal cells, and the inner one which is related to the filtration barrier is the visceral epithelium. The outer one is the parietal epithelium, and the inner one is the visceral epithelium, which lies in relation to filtration barrier. So these are the podocytes. So similarly, the outer one is the parietal cells of the Bowman's capsule, the inner one is the visceral epithelial cells of the Bowman's capsule, and the middle one is the basement membrane, and these are the endothelial cells of the capillaries, which is forming the filtration barrier. Now these deposits can occur anywhere in the glomerulus. So it can occur in the basement membrane. So deposit can occur in the basement membrane. It can occur in the subendothelial region. Subendothelium, it means below the endothelium layer. So this is the endothelium of the capillaries, and the deposit is occurring below the endothelium layer, that is at the junction of the basement membrane and the endothelium. So this is known as subendothelial deposit, and the deposit can also occur below the podocytes. So the deposit can also occur below the podocytes or at the junction of the basement membrane and the visceral epithelium or the podocytes. So these are known as subepithelial deposits. Subepithelial deposits. And the deposition can also occur in the mesangial cells, and the deposition can also occur between the mesangial cells. So these are known as mesangial deposits. Now when it occurs in the membrane, it is known as intramembranous deposit. Intramembranous deposit. These intramembranous deposits are seen in membranoproliferative glomerulonephritis type 2, that is MPGN type 2. Intramembranous deposit is seen in membranous proliferative glomerulonephritis type 2, whereas subendothelial deposit, that is the deposition at the junction of the basement membrane and the endothelium, can be seen in membranoproliferative glomerulonephritis type 1, that is MPGN1. And it can also be seen in lupus glomerulonephritis, where you can see wire loop lesion. So wire loop lesion is a feature of lupus glomerulonephritis. So subendothelial deposits can be seen in MPGN type 1 and lupus glomerulonephritis. And subepithelial deposits, that is deposition at the junction between the basement membrane and the visceral epithelial cell, is known as subepithelial deposits, which can be seen in case of RPGN, that is rapid proliferative glomerulonephritis, PSGN, that is post streptococcal glomerulonephritis, and MGN, that is membranous glomerulonephritis. And this will be seen as hump sign. So it is seen as lumpy, dumpy, humpy sign. Huge deposit can be seen below the epithelial layer. So this is the podocytes, and below the podocytes you will see a lumpy, dumpy deposition, and between the podocyte and the basement membrane. This deposit is also known as hump sign. Now there are deposits in the mesangium, which is known as mesangial deposit, and it is seen in IgA nephropathy or Buerger's disease. Coming to immunofluorescence microscopy, we can see three types of pattern. One is linear pattern, granular pattern, and band-like pattern. Linear pattern is suggestive of antibody-mediated glomerulonephritis, that is type 2 hypersensitive reaction, because it is antibody-mediated, and antibody is against the basement membrane. Here the antibody is against a fixed antigen on the basement membrane. For example, Goodpasture syndrome. Goodpasture syndrome is anti-GBM antibody. Therefore, linear pattern is suggestive of antibody-mediated type 2 hypersensitive reaction, and antibody is against the basement membrane. So you see a linear immunoglobulin deposits over the basement membrane. So this is also known as linear ribbon-like pattern. And you will see a green homogeneous of same intensity. The pattern is of same intensity, it is homogeneous, and it is green over the basement membrane. Now coming to the granular pattern. Granular pattern is suggestive of immune complex mediated. It is suggestive of immune complex mediated, as seen in case of post streptococcal glomerulonephritis or acute proliferative glomerulonephritis, membranous glomerulonephritis, and MPGN type 1. In this case you will see dense granular pattern. It is not homogeneous like that of linear pattern. In linear pattern it was homogeneous of same intensity, whereas in granular pattern it is heterogeneous, or it is irregular dense granular deposit. Whereas in case of band-like pattern is suggestive of dense immune complex mediated. It is suggestive of dense immune complex mediated, and it is seen in MPGN type 2, where you will see a band-like dense deposit along with granules. So this is all for today. We'll discuss various conditions in our upcoming videos. So thank you.